Now that I'm at the end of this RN to BSN program, I can see how much I've grown, not just in knowledge, but in how I understand myself as a nurse. When I first started my career, my personal philosophy was simple: provide compassionate and equal care to every patient. And I would always ask myself, how would I want to be treated if I were the patient? That belief is still central to who I am, but this program has deepened the way I put that philosophy into practice. I've learned that nursing isn't just about task or technical skill. It's about stepping into the patient's world and seeing their fears, hopes, and vulnerabilities. Some nurses shape their philosophy strictly around clinical practice, but I've come to believe that the most impactful nurses step back and truly imagine themselves in the patient's position. This mindset builds trust, strengthens communication, and creates meaningful patient-centered care. Through coursework, reflection, and evidence-based learning, my identity has evolved into one that is more confident, more informed, and more aligned with the values of the profession. The personal values that guide me is compassion, hard work, and honesty, which are the foundation of my practice. Compassion pushes me to care for patients as people, not diagnoses. My strong work ethic helps ensure that I provide thorough, safe, and reliable care, and honesty allows me to maintain integrity in every interaction, which builds trust with the patients and the people that I work with. These values align with the core commitments of nursing, which are dignity, integrity, advocacy, and accountability. They remind me of the responsibility I carry and why nursing is more than a job. It's a commitment to doing what is right for someone else, even when it's difficult. Professional standards from the American Nurses Association and the State Board of Nursing have played a major role in shaping my professional identity. They provide the framework for what safe and competent nursing practice is, and they guide the boundaries of my role. They hold me accountable, and they help me understand what is expected of me as a licensed nurse. Nursing ethics expands on that by centering values such as dignity, compassion, justice, and advocacy. These ethical principles help me navigate complex and emotionally challenging situations. They remind me to respect patient autonomy, provide culturally sensitive care, speak up for safety issues, and advocate for equity. Together, these standards and ethics form the foundation of why I practice the way I do and how I continue to grow as a responsible, ethical, and compassionate nurse. So some BSN outcomes from this program is I developed leadership abilities, especially in leading myself. Coursework on leadership, conflict management, and reflective practice helped me understand how to remain calm under pressure, how to advocate for safe practice, and how to communicate with confidence. These skills will be essential as I move forward in my nursing career. I've learned to advocate for health equity. I explored how factors like education, income, and access to care can impact outcomes. This taught me how essential it is to address disparities and to educate patients in ways that are culturally relevant and easy to understand. I strengthened my ability to use information and communication technologies to support safe, quality care, whether it's using it EHR, clinical databases, or researching through evidence-based literature. I learned to use technology as a tool to improve outcomes. These skills translate directly into clinical setting where accurate information and timely documentation is critical to patient care. I improved my interprofessional communication and collaboration skills through assignments like my IP experience hours and during my projects this final semester. My vision for me as a nurse is to become a highly skilled and compassionate NICU nurse who supports newborns and their families during some of their hardest moments. I want to be the kind of NICU nurse who combines clinical expertise with empathy. My long-term goals include contributing to my unit by doing quality improvement projects, supporting developmental and family-centered care, and helping improve outcomes for premature and high-risk infants. I also hope to eventually mentor new NICU nurses or precept nursing students so I can help shape the next generation of nurses. I also want to continue strengthening my communication skills because NICU nursing requires not only technical knowledge, but also the ability to support families through grief, fear, and uncertainty. I will prioritize my own self-care because the NICU environment can be emotionally demanding, and maintaining balance is essential for providing consistent and compassionate care. By committing to lifelong learning, emotional intelligence, and evidence-based practice, I hope to make a meaningful impact on infants and their families and the community as a whole. This RN to BSN program has shaped my professional identity in ways that will stay with me throughout my career. It's strengthened my values as a nurse. It's deepened my understanding of professional standards. And it's expanded my leadership skills and my confidence in nursing. I'm leaving this program extremely more confident than when I came in. I'm more prepared, and I'm more committed than ever to be the kind of nurse who can make a real difference. Thank you.